Okay, so this is the third topic for our, what do you call this one, our discussion, back to laboratory. So the third one is about the general concepts for specimen collection and handling. So we'll discuss the appropriate collection techniques. Okay, specimen should be collected during the acute early phase of illness within 2 to 3 days for viral infection and before antimicrobials are given or medication are given. Why is this so? So that we will be able to grow the bacteria. So remember, this is bacteriology. We are more of cultivation. Pag after na yung acute or early phase of illness or after administering antibiotics and the population of the bacteria is lowered or is already low, there's a chance that we may not be able to grow them in the laboratory that may lead to false diagnosis. Okay? So, responsibility ng microbiologist to provide clinicians with a collection manual or instruction cards. It's because this is very important for bacteriology specimens. Okay, so if we are not going to provide them collection manual, like for example, getting samples for urine culture and sensitivity. So dapat kasi for urine CSGS, if that is done by the patient self-collection, so the medical technologist must, in case, what they call this one, instruct them to get the midstream clean catch. Okay, so we have the responsibility to ensure that the specimens are of good quality so that we can grow the bacteria that are present in it. So, meron din kasi yung mga, an example of this situation is that what if the collection happens in a physician's lab, tapos ipapadala lang sa atin dun sa main laboratory yung sample. Okay? So, we must provide instruction on the specimen transport. Kasi there are specimen that must be transported with ice. Yung iba naman should be transported within room temperature. Okay? So, in the collection manual, the following must be included: safety consideration, appropriate anatomic site and specimen, like yung mga abscess, ganyan. Collection instruction, including the type of swab or transport medium, okay, and others. Of course, don't forget to label, okay. There are also sterile versus non-sterile. What do you mean by sterile? Malinis. Okay? Dapat free from contamination. Wala siyang contamination. Minimal acceptable quality and recommended quantity. So there are cases na it requires a minimum volume of samples. Okay? Meron din before sa, what they call this one, EFB staining kapag salivary, hindi daw i-accept. Okay? Pero noon yun, na iba na modify. Collection procedure: specimen for microbiology culture should be collected in sterile containers, except for stool. Bakit kaya? Kahit hindi sterile, yung pagkukuhanan for stool samples. Kasi si stool pa nga lang, it's not sterile. Okay? So, hindi naman ibig sabihin na dapat hindi malinis. Pero, not necessarily na free from contamination. Okay? That's why sa laboratory, there are cases na anong makikita mong lalagyan ng stool. Pinag-ubusan ng mayonnaise, ng butter, ganyan. Di ba? Nilalagay nila yon doon. And we still accept it. Pero kapag mga urine samples, hindi pwede. Okay? As long as that should be clean and leak-proof container for stool sample. So, yun by swab. Okay? So, have you seen yung sa cotton buds? Parang ganun yung swab usually na ginagamit natin. Pero mahaba yung wooden port. Okay? So, generally, swabs are not recommended for collection because they do not provide sufficient quantity, easily contaminated, and can become dried out, leading to loss of organism. Lalong-lalo na kapag it takes too much time from collection to transport. Si swabs are not recommended. So, if there are cases na malayo yung laboratory from the processing lab, and it will take hours. Yung mga satellite laboratory, ganyan, ang mga main laboratory, magpapadala na lang sila ng mga transport media, okay? To ensure proper collections. Kasi yun nga yung mga disadvantage ni swab. Pwede siyang mag-dry out and the bacteria may die that may lead to false diagnosis, false negative. But swabs are appropriate for specimens from the upper respiratory tract. Yung mga nasopharyngeal swab, external ear, eye, and sa genital tract. Okay? Yung sa private part. So, we have here types ng swab, si cotton tip swab, okay? So, and then si dacron or polyester swabs. However, for me, in my experience, usually ang ginagamit lang namin is cotton tip swabs. How about for lesions, wounds, and abscesses? So, in the request of the physician or in the requisition, it must be indicated there yung location of abscess. Okay? Location of abscess, is it also found in the left side of the body or in the right side? Like for example, right ear, left abscess found in abscess found in left ear, mga ganyan. Fingers, abscess in finger, and what part of finger. So those must be specified. So of course, cleansing is very important. The area should be cleansed to eliminate as much of commensal flora as possible. Because sa skin kasi natin, it contains bacteria. That's why technically we are dirty. We are full of bacteria. Our skin is full of bacteria. It has commensal flora or normal flora. So these are bacteria found in the skin that do not elicit any harmful effects. That's why they are termed as commensal. Okay? So, specimen is collected from the advancing margin of the lesion and should be collected by needle aspiration rather than swab. So, yung mga abscesses, okay, usually, or what is recommended should be needle aspiration. You aspirate the abscess instead of using swab. Okay, yun yung mas recommended. So, we have here specimen collection guideline that you have to, what do you call this one? You have to familiarize. Okay, usually, so for example, we have blood culture. So, you disinfect the site or you will perform the venipuncture with alcohol and iodine or chlorhexidine. Okay, so it's a combination. So, blood culture media must be used both aerobic and anaerobic. So, yun nga, we have here yung SPS, sodium polyunsaturated sulfonate, as the recommended anticoagulant for blood culture. Usually, kapag adults, up to 20 ml per set. Okay? And pag children, 5 to 10 ml per set. Usually, yung mga blood CS is two sides, left and right side of the body. So, if that's the case, dapat mas specify din kung saang side, left or right ba. Okay? So, sa body fluids, disinfect, usually, all I think, mostly, should be disinfected before needle aspiration if it involves skin. Yun nga, I already mentioned to you the reason why is because of the presence of commensal flora that may lead to false diagnosis. Okay, so dapat present din ang for anaerobic transport. Okay, so sa CSF, should be more than 1 ml. Okay, pag bacteria, pag fungi, more than 2. AFB, more than 2 ml, acid fast bacilli, and for viral, more than 1. Okay? So, you clean the ear canal for the ear, okay? Or remove debris from the outer. So, use swab transport system or anaerobic transport system. So, you familiarize yourself, guys, with this, yung mga collection guidelines. Will not discuss this in detail kasi it's already here. Hindi siya ka-discuss because these are guidelines. Okay? So, what you see there, yan na mismo yun. Okay? Hindi siya minimodify based on what you want as medical technologists. Okay? So, sa urine, usually it's the first morning specimen that is preferred because it is more concentrated. Okay? It is more concentrated. However, if this is not possible and kailangan na talaga mag-collect ng sample, dapat midstream clean catch. Okay? Midstream clean catch. So, the patient collects urine following cleansing of the external genitalia to reduce the presence of indigenous flora. Kasi not only the skin but as well as yung private part natin that is full of commensal flora. And actually, these commensal flora are good. They give us benefits. Why? Because they act as barrier against foreign microorganism. Okay. Uh-huh. Patients are asked to void without collecting the first portion of the urine flow and instead collect the middle portion. Question is, should the patient stop? Di ba umihi na siya, tapos i-stop bago ilagay yung collections container? Should the patient stop her urine during collection of the midstream clean catch? Dapat hindi. Okay? So, continuous lang na ihe kapag nakaihi na, hindi i-collect yung first specimen, yung first na lalabas instead dun sa gitna. Okay? So, sputum naman. Of course, sputum sample often collected for the diagnosis of bacterial pneumonia. But usually, yung mga sputum natin, these are also utilized for AFB microscopy. Okay, so sa Mycobacterium tuberculosis. A single specimen should be adequate for detection of bacterial lower respiratory tract infection. If fungal or mycobacterial infections are suspected, 3 separate early morning specimens are appropriate. Okay? So, tatlong sunod-sunod daw na specimen, first morning specimen. That is to establish. Okay? Collection of a quality sputum sample requires thorough patient education and medical personnel. First early morning specimen is the preferred one. Okay? So, the medical technologists are the one who gives instruction must instruct the patient to rinse the mouth with water and expectorate with expectorate with the aid of a deep cup directly into the sterile container. So that should be expectorated sputum and not salivary. Kasi kapag salivary lang siya, it lowers the chance for us to see yung EFP. Okay? Although, hindi na natin nare-recheck ang salivary samples. Patients with dentures, dapat tanggalin muna yung mga pustiso. Okay? So, patients who are unable to expectorate may be collected through aerosol induction, in which the patient breathes aerosolized droplets of a solution that stimulates the cough reflex, so that is already induced sputum. However, naman in our country, we don't usually practice this one. Okay, yung giving aerosolized droplets. So, kung ano yung binigay ni patient, yun na yan. Stool. Specimen for the detection of GIT pathogen. So, usually, ano dapat yung i-expect natin from stool? Salmonella, Shigella, mga ganun. Okay? Rectal swab can also be submitted. Okay? As long as fecal material is visible on the swab. If a bacterial infection is suspected, 3 specimens should be collected, 1 a day for 3 days. So, to establish the test result, okay, dapat at least 3. If parasites are suspected, 3 specimens collected within 10 days should be sufficient for microscopic detection of ova and parasite. Okay? So, pag parasitology, at least 3. Yun yung nire-require ng book. Pero in reality, isa lang. Minsan, isa lang talaga yung nire-request ni patient. Okay? So, specimen transport. Ideally, the specimen must be present in the lab within 2 hours. Okay? Take note also of this one. Dapat leak-proof yung container. Okay? Sealable. Okay? And naka-plastic bag siya. So, it should have also the biohazard bag symbol. Yan, yung sa biohazard. Yung parang 3 arrow. Okay? So, specimens delayed more than 2 hours should be preserved. Okay? This special preservative or temperature controlled or holding media to ensure organism viability or survival. Usually, if this is unavoidable, depending on the specimen, nire-ref Okay. Nire-refrigerate. Okay, so we go to specimen preservation. Okay, so preservation we have here boric acid for urine specimen, that is to maintain appropriate colony count. Meron ding polyvinyl alcohol and buffered formalin, that is to maintain integrity of trophozoites and cysts. Okay, so there are many others for um, parasitology. Okay, stool preservation, if that is not transported within 2 hours, okay, yun nga yung sinasabi ko, it can be refrigerated. Okay? If the delay is longer than 2 hours, carry Blair transport media should be utilized. Okay? Stools for Clostridium difficile toxin assay should be collected without preservative and pwede siyang ma-refrigerate. Okay? Pero if more than 48 hours yung delay, bakit naman umabot ng 2 days? Pag yung mga pinapadala for confirmatory, mga ganyan, it should be frozen at negative 70 degrees. Pero usually, hindi ito ginagawa kasi nga, it's hard to find a refrigerator that can provide negative 70 degrees. Di ba? So, yung mga freezer lang natin usually hindi naman umabot ng ganyan. Transport or holding media. So, yun nga, yung like example si Carrie Blair, transport media. It maintains the viability of microorganism present in the specimen without supporting the growth of organism. It means that it keeps the bacteria, if in case bacteria is present, it keeps it alive without nurturing it, nang hindi niya pinapadami. Yun yung ibig sabihin nun. Gets? Okay? So, it maintains viability without supporting the growth nang hindi niya pinapadami. This maintains the organisms in a state of suspended animation so that no organism overgrows another or dies out. Bakit? Kasi what happens if it dies out? Hindi na natin siya mapapagrow. Hindi natin siya mapapadami sa lab. If that happens, that leads to false diagnosis. Okay? Charcoal is added to this media to absorb fatty acid present in the specimens that could result in pH changes in the media and killing fastidious organisms such as Neisseria, gonorrhea, or Bordetella pertussis. Okay? So, naglalagay ng charcoal if in case yung mga fastidious bacteria are suspected so as to keep them viable or alive. Okay? So examples of this media is the Stewart's medium and the Anise medium. Specimens for Neisseria gonorrhoeae can be placed directly into commercial transport system just like the Gembeck system. So this is a transport system for Neisseria gonorrhoeae. Okay? This system contains selective agar and carbon dioxide generating tablet. So, how about for anticoagulants? Yun nga, it prevents clotting of specimen. So, usually anticoagulants are indicated for blood, bone marrow, mga fluid. Okay? If your specimen is fluid, preservative or anticoagulants must be added. Why? To avoid clotting. Kasi syempre kapag nag-clotting yan, na-activate na yung coagulation cascade. Okay? That may lead to what? Killing of the bacteria. Okay, so this is yung recommended sodium polyanethyl sulfonate. If you remember, yung sa yellow, the first one in the order of draw. Okay, yan yung commonly utilized because it prevents clot formation, it prevents complementary and phagocytic properties, and it interferes with the activity of some antimicrobial agents gaya ng mga aminoglycosides. The problem with SPS is that it may inhibit the growth of the following. Pwede niyang pigilan yung pagdami. Okay? This is a good thing actually for the anticoagulant na si sodium SPS. Okay? It can inhibit. Yun nga lang kasi in culture na pala, yun yung problem. If we culture this bacteria, there's a possibility that they may not be able to multiply kasi may inhibitor. The addition of 1% or 1.2 gelatin can counteract the inhibitor component ng sodium polyanethyl sulfonate. Okay? Sodium polyanethyl sulfonate. So, yan. Do not forget those. Okay? So, yung mga advantages and disadvantages of the recommended anticoagulant for bacteriology assays. Because of the ratio of specimen to SPS is so important, it is necessary to have both large and small tubes available. So organisms in small amounts of bone marrow or synovial fluids are not overwhelmed by the concentration of the SPS. So dapat merong malaki and small size na tube that contains the SPS. Okay, para hindi, kapag masyadong malaking tube means it contains a lot or more anticoagulant. And if your sample is very small, syempre, masyadong mataas yung concentration ng anticoagulant. Okay? Heparin is also commonly used anticoagulant for viral cultures, pero yun nga, it may inhibit the growth of gram-positive bacteria and yeast. So, the others, hindi dapat sila ginagamit. Should not be used for microbiology. Okay? So, we go to specimen storage. We have here, if they are not processed immediately when they are received, the following are the options for the medtech. Pwedeng ref temp, room temp, body temp, or incubator. Pag sinasabi natin body temperature, 35 to 37 degrees Celsius sa incubator yan. And of course, sa freezer, 0 degrees up to negative degrees. Kapag mga ref temp, these are the following samples that can be stored in the ref: urine, stool, sputum, swab. Okay? Pag mga anaerobes, hindi dapat refrigerator. Okay? So, or not for swabs. Foreign devices, mga catheters and viral specimen up to 24 hours. Pag room temp naman, okay, samples that may contain anaerobic bacteria. What do you mean by anaerobic bacteria? Bacteria that grows in the absence of oxygen. Okay? So, kagaya ng mga other samples, sterile body fluids, okay, and others, yung mga swabs, ear and eye swabs. Pag body temp naman, CSF, okay, sa incubator, dapat nilalagay si CSF. Serum for serologic studies may be frozen up to 1 week. Pero kapag longer term, it should be negative 70 degrees. Okay? So we have here specimens na recommended for that should be refrigerated. Okay? So yan, this should be refrigerated while this one should be what? Under room temperature lang. Okay? Under room temperature. And we have here CSF sa incubator and here CSF for bacteria. Pag for bacteria, room temperature. Okay? Yung feces naman, kapag preserve siya, hindi mo na siya ilalagay sa refrigerator. Okay? And of course, do not forget yung specimen labeling. Yung specimen labeling depends on the protocol of each laboratory. Pero usually, nandyan yung patient's name, identifying number or the accession number, birth date, date and time of collection, and source. Okay? Pero hindi ganyan kadami talaga in reality. Ito lang yung by the book. Sa specimen requisition, do not forget, of course, complete details, name, and others, birthday, requesting physician, the test request, okay, kung ano yung mismong test na request niya, okay, pero kapag mga computerized system, okay lang naman, kahit the requisition is transported to the laboratory electronically, pero still, meron pa rin siyang kasamang paper, pero pwedeng paper lang na not the official request slip of the physician. Pag yung mga high-tech labs, high-tech hospitals. Okay? So, it should contain the following. A complete requisition should include the following, of course. Okay, huwag kakalimutan, collection date and time, and yun nga, exact nature and source of specimen. It should be specified kung saan nakuha. So we have here, okay, rejection of unacceptable specimens, priorities, order of priority, and this one, yung table. Okay, ito yung mahaba. Anyway, dito muna tayo sa rejection of unacceptable specimen. Okay, so in general, specimens are unacceptable if any of the following conditions apply. Why? Kasi yun nga, it may lead to false diagnosis, or it may kill the bacteria, or the chance of culturing the bacteria is very low. So, information the label does not match, reject agad yan. Communicate, reject. Okay, magkaiba. Okay, magkaiba yung nasa label ng specimen from that of the requisition request. Sabi, right ear. Okay, sa requisition, left ear. Reject na yun. The specimen has been transported at the improper temperature. Okay, reject. The specimen has not been transported in the proper medium. Reject. Okay, the quantity is not enough. Kulang. QNS, quantity not sufficient. Kulang yung volume. Nagli-leak. Reject. Pag more than 2 hours from the time of collection and hindi siya na-preserve, pwede mong i-reject. Okay? The specimen was received in fixative. It should be rejected. Why? Kasi the formalin, the fixative, kills the microorganism. Ano pang i-culture natin? The specimen has been received in anaerobic culture from a site known to have anaerobes as part of the normal microbiota. So, anaerobic culture yung pinaglagyan, pero possible na aerobic yung microorganism, pwede mong i-reject. Nag-dried na yung specimen. Sputum sample, tas wala na, as in dry na. You can reject that one and ask for the patient to recollect the sample. Processing the specimen would produce information of questionable medical value. Okay, yung mga Foley catheter tip, yung pagkukuhanan mo ng sample. If that is not the appropriate sample for the test, you can reject the sample and ask the patient to recollect again. So it is important to always talk to the requesting physician, okay, before discarding an acceptable specimen. Depending on the SOP. Pwedeng may ganito, pwede mo namang i-reject agad. Okay? But this is particularly important if the specimen was collected using an invasive technique, kagaya ng sa CSF sample, mga biopsy, ganyan. So, communicate. Okay? So, mislabeling of a specimen may be corrected by having the person who collected the specimen and filled out the paperwork come to the laboratory and correct the problem. Okay? So, pwede din naman na mislabeled siya. Okay? Like, for example, left ear, pero right ear yung nasa requisition. So, you just ask the one who collected the sample, okay, to change it and verify it. What if kinuha niyo talaga sa left ear? Or what if nagkamali lang siya ng label? Okay? So, you should ask the person to verify it. It is often necessary to do the best possible job in a less than optimal specimen. It would be impossible to collect the specimen again because the patient is taking antibiotics. The tissue was collected at surgery, example, or the patient would have to undergo a second invasive procedure, yung sa CSF collection or the bone marrow or spinal tap. So yung mga yon, just because walang label, tapos CSF specimen, i-reject mo. No. It depends on the situation. Okay? Pag CSF yan, you communicate. That is not a usual procedure, most likely. Pakonti-konti lang yung kinukuhanan ng ganyan. Okay? You verify it with the physician because it's the physician who does the procedure. Huwag mong i-discard, huwag mong itatapon. Okay? Order of priority. For example, you receive a stool sample and meron kang urine sample. Ano kayang uunahin mo? Or CSF sample, nauna si urine and stool pero may dumating na CSF. in bacteriology, it doesn't apply yung first come, first serve basis. No, it doesn't happen that way. Okay? Hindi siya first come, first serve basis. Hindi kagaya sa HEMA, sa CC, yes, first come, first serve basis. Pero kapag may stat doon, uunahin si stat. Dito, walang stat, pero may specimen priority. Kahit nauna si urine sample, the CSF came next, you should prioritize the CSF. Ganun siya ha. So when multiple specimens arrive at the same time, priority should be given to those that are most critical, such as CSF, tissue, blood, and sterile fluids. Urine throat, sputum to, sputa, okay, stool or wood drainage specimens can be saved for later. On arrival in the laboratory, the time and date received should be recorded. So this is very important, guys. Time and date received is very crucial for bacteriology specimen. Acid fast, viral, and fungal specimens are usually batched for processing. And when a specimen is received with multiple requests, but the amount of specimen is not enough, the microbiologist should call the clinician to prioritize the testing. So we have here description and specimens. We have level 1, 2, 3, and 4. Okay? So level 1, critical and invasive, represents a potentially life-threatening illness. So sila yung priority, amniotic fluid, blood, brain, CSF, heart valves, pericardial fluid. Okay, because infection to these sites are very crucial. It's very critical and it means invasive kasi yung bacteria nasa loob na ng system. Unpreserved. So, specimens are unprotected and may quickly degrade. So, sino yung kasama sa unpreserved? Okay, pwedeng bone, drainage from wounds, feces, sputum, and tissue. Sila yung next. Okay? So, critical, level 1, amniotic fluid. Second, body fluids that are unpreserved. Quantitation required, sila catheter tip, urine, tissue for quantitation, and next, and lastly, yung mga preserved specimen. So, meron tayo dito yung feces. Okay? So, if this is preserved, syempre sala siya. Pero kapag unpreserved, nasa level 2. Okay? Even si urine, it's here. Pag mga preserved kasi, pwedeng sila na yung least priority. Sila na yung level 4 mo. Okay? Pero kapag mga hindi sila preserved, syempre, depending on the level. So, this is the order of priority. Critical invasive, unpreserved, quantitation required, and the preserved one. Level 1, 2, and 3, 4. Pinaka-priority pa rin si level 1. Okay? So, that ends the first part of our discussion. Thank you so much. Siguro, muna. Let's see. Ano ba itong mga to? So, your review for your quiz tomorrow.